I am always so privileged whenever I have visitors to my practice at Sunrise Urology. And today we have Carly and Megan from Fellow. They make one of their products is they post vasectomy semen analysis kit. Basically, after I do a lot of vasectomies, I want to make sure that the patients actually carry out the post vasectomy semen analysis because there's always that remote chance of recanalization, and the only way to make sure that the vasectomy is successful is to have that semen analysis tested. Now, Carly and Megan came over and watched for the last couple of hours, hung out here and watched us do a few vasectomies, and I just want to ask them about their impressions and what some of their takeaways are. So, Megan, what do you think? But first of all, congratulations on your recent marriage.
Oh, thank you so much. I
All right.
appreciate it. Overall, my biggest takeaways from being here is one, the efficiency from this office, from the person at the front desk all the way to the provider. I mean, you really do get great customer service here, and I can tell that you genuinely care about your patients and their satisfaction and having a good experience. So I can't recommend your clinic here more.
So when you say efficient, what exactly do you mean?
Um, there's a lot of things that you do here in terms of communication to improve the timepiece because there's a lot of documentation and things that need to be done here at the office. And your process is very streamlined to make sure that we are saving as much time as possible so that you can spend the time with your patients and explaining things to them and really giving them that attention that they need.
Okay, well, Carly, what do you think?
I mean, I would echo that. The efficiency is incredible. I think that the attention to detail happening way before you're even seeing the patients in the office is incredible. The way your staff is on board with all of this and they understand the rhythm and they're working right alongside you and that perfect in sync is just incredible.
Sounds like you're saying that there's some preparation involved.
Yes, absolutely. I mean, it's clear that you have spent a ton of time investing in the systems here to make patients comfortable, to make it the best experience possible. And I think that really shows even on the faces of these guys as they're walking out of the room.
So what were your thoughts? Let's see, have you seen a vasectomy before today or no? Neither of you.
No.
Okay, so what are your thoughts seeing the vasectomies for the first time?
I think it's amazing how easy it is for the guy. It's such a quick procedure for them to not be fertile anymore, which is amazing. It's so different from the female side. I've
Oh
seen
yeah.
that side before, so that to me just kind of blew my mind at how much quicker it is for the guy to get this done.
It's really safer, faster, easier, and cheaper.
Yes, absolutely. And your efficiency in particular.
Yeah. What are your
Yeah.
thoughts?
I mean, I agree. I think like seeing this after being in so many different ORs with previous roles, and seeing how quick and simple this procedure really is, and yet how much you've invested into fine tuning it to make it even simpler and easier on the patient is just incredible.
Yeah, I worry about every small steps and including how many times I take my eyes off of where I'm working
Right.
because every time you refocus, it's a fraction of a second lost.
Mhm.
And I want to make sure that the patient's on and off the table as quickly as possible because guys are generally nervous, especially young guys coming in for their vasectomies. So, what would you tell, when you visit other practices, what are some of the things that you would recommend that they consider doing?
In terms of efficiency or
Yeah,
just things that
vasectomies
you
in
are doing,
general.
I would tell them that it's a really easy, quick procedure, that our fellow kits make it really easy for us to test and make sure that the procedure was successful, and that it's a really great option. It's way less invasive for the guy to do this than the female, so there's just really so many benefits.
Yeah.
Well, without much experience in other clinics,
Yeah,
I
of
think
course.
what they could learn the most from is probably the way that you interact with your staff. I think that the way that you have helped them be confident and the way that they're working with you, even like with the pedal being in the wrong place. Like Irma was very relaxed about that. Like she understood the consequence, but it was very much just this was just a quick mistake in the middle of the day. Teaching them that efficiency, the importance of all these steps, I think that that is probably one of the key steps to making this run as smoothly as your office does.
So you said the pedal that you're talking about is the pedal that I use to activate the bipolar electrocautery to cut and also cauterize the vasectomy, the vas deferens. It's always in the same position. I don't have to look to activate it. But this time, for one of the cases, it was not in the right place. That's what you were talking about. And it comes down to having a system set up so that you can reproduce a reproducible type of a setup so that you do it the same way every time, and the staff knows what to do, how to set it up, and expectations are set. But if things don't go perfectly, then so what? You fix it mid-course, and no, there's no loss. It still everything took less than 5 minutes.
Yeah.
It's despite the fact that the pedal was in the wrong place. No
Yeah.
big deal.
Yeah. I think it's great too. I've just noticed being in the clinic how happy your staff is, how happy everyone is that works here. And I think that really contributes to your patients coming in and having a good experience as well. So I just wanted to compliment you on
Well,
that
thank
as
you.
well. Yeah.
It's not always the case. I am not perfect, and I make mistakes. And as a matter of fact, I need to apologize to one of my staff members tomorrow when she comes back because of how I behaved yesterday. So I'm constantly trying to improve. I'm not perfect, but we do have a pretty good culture and system, and that is what we strive for. And once you build that culture, if you have someone who's like who doesn't work the same way or think the same way, then we try to hire fast, but we fire even faster because they're a
Yeah.
little cancer. If you
Yeah.
have that
Mhm.
that negative Nelly in the practice, they will bring everyone down. So we hire quickly, fire even faster, but we try to hire on attitude. And we
Hmm.
can train you on how to do this, all
Yeah.
this stuff. But if you have a bad attitude, if you're not happy, you're just a grumpy person, patients will feel that.
Yeah.
If you have a grumpy doctor, you have a grumpy staff, patients will feel that. And like we mentioned before, it is the bar is so set so low for healthcare practices to stand out
Yeah.
on a positive note that it's really easy to do a little bit and then you look great.
Yeah.
Yeah, absolutely. It's definitely something that I think Carly and I both noticed being here was just the positive energy from everyone and that the patients were all walking out smiling, happy. I mean, not many people leave the doctor's office happy, but everyone here seems
It's a
to.
laughing gas.
Yeah, or maybe it's that. Yeah, who knows?
It's not only that.
No, thank you so much for having us here today. We really learned a lot.
You're welcome.
Yeah. I do just want to say I really admire the way that you're running this and the fact that you took so much time to invest in us learning this since
Yeah.
we're both new to this aspect of urology.
Sure.
Just thank you so much, and
You're
thank you
welcome.
for your kindness and generosity with everything today.
You're welcome.
Yeah.
Thanks for spending time here.
Thank you
Of
so
course.
much. We appreciate
Yeah.
it.
Anytime.